Sometimes, like I said, we do HIPEC with the intention of drying out the ascites. I have done it for patients that have carcinomatosis from breast cancer, which obviously is not, we don't do cytoreduction in those kind of patients. But when we study how effective the HIPEC is to drying out the ascites, overall, it was over 75% of the time. You may remember I spent some time also with Dr. Sardi, and I think one time we did it for a patient that had intractable ascites from prostate cancer. So the goal of the HIPEC in those particular cases is to target the area that has small tumor nodules, not bulky disease. HIPEC penetration is limited, but in those patients that sometimes have just a miliary distribution, I usually describe it as somebody open up the patient and just threw a bunch of kosher cooking salt in there and splash it all over. So when you have a small tumor nodules and ascites, that is a perfect target for the HIPEC. If you have ascites after you have had treatment, that just means that the treatment didn't work or the disease has come back. Ascites by itself, you can see it sometimes in the absence of tumor, and it's more like a consequence of transecting what's called the thoracic duct during the surgery, but that would be very unusual, and it's kind of like a milky ascites. But when you have ascites that needs to be tapped frequently after treatment, then that just means that the treatment did not work.